The following portion of Studio 512 is sponsored by Superior Physical Medicine. Dr. Bryce Cunningham with Superior Physical Medicine joins us in the studio today to discuss peripheral neuropathy and how his practice can help patients get out of pain and back to living the life they want. Dr. Cunningham, my first question to you is, could you define for us what peripheral neuropathy is?
Sure. In the simplest form, it's damage to the peripheral nerves, affecting the nerves furthest from the heart, so like in the feet and the hands.
Gotcha. Okay, so what would be some symptoms of peripheral neuropathy?
Well, the most common symptoms are going to be like burning, numbness, tingling, pins and needles, loss of balance, sometimes cramping in the muscles, even the sensation of ants crawling on your skin. Some patients describe a sensation like the sock is bunched up in their shoes. Even patients that are trying to sleep at night, sometimes just the covers touching their feet is painful.
Interesting to hear. And I know that as we get older, balance becomes so much more important. So it is something that we want to address because it's a progressive disease. Is that correct?
That's correct. So with neuropathy, it's a degenerative condition. So the longer it goes untreated, the worse it can get. And the number one cause of preventable death over the age of 65 is falls. So we take that very seriously.
Okay, which is why we want to intervene as soon as possible. Why do you say it's important, Dr. Cunningham, to treat peripheral neuropathy without medications?
Well, medication's just masking the symptom, and with medication, it's not causing the nerve to regenerate. There's also a risk of addiction or side effects such as loss of muscle coordination, decreased energy, fluid retention. So oftentimes it's a metabolic condition, and we have decreased blood flow and circulation to the terminal ends, which would be the toes and the hands.
Gotcha. And so what you do is you address the metabolic kind of base of our systems, right?
Correct. We want to get to the root of the problem.
Gotcha. Okay. Who would be a great candidate for treatment?
Well, anybody that's experiencing those symptoms would be a good candidate for treatment.
What if they don't know if they actually have peripheral neuropathy?
Well, the only way to find out is to have a consultation. It's free. You can sit down with me one-on-one and we'll discuss the problems you're having.
And so if somebody is watching today and they're thinking, okay, I don't know actually, or maybe they do have a peripheral neuropathy diagnosis and they're just interested in learning more about the way you approach medicine here, how can we learn more information?
It's simple. Pick up the phone, call the office, schedule your free consultation and screening, and we'll answer your questions.
Sounds good to me. Dr. Cunningham, thank you for your time.
Thank you.
The first 25 people to call in will receive an in-depth consultation and screening absolutely free. Call 512-722-7730 to get started right now. The preceding portion of Studio 512 was sponsored by Superior Physical Medicine.